From a study of the development patterns the infant uses, here are the exercise progressions we adopt for rehabilitation of the stroke patient. Lying on the back with knees bent and hands clasped to reach forward at shoulder level, rolling from side to side. Each advancing position must be stabilized. In this instance, the patient must be stabilized in side lying. Continuing this rolling pattern to complete the rotation. The same pattern, but stopping the movement in forward lying, propping on the elbows. Lying on the back again, arms resting out to the side, lifting the buttocks upward. We call this bridging. Lifting the head forward and rolling round to rest on the elbow and forearm. Continuing this movement, rolling on round to prop up on both forearms. Rolling on to the back. Rolling over into the crawling position. Which leads to crawling. To high kneeling and to walking on the knees. Reversing this pattern, moving back into the crawling position and rolling onto the back. Learning to move across the high mat. And rolling round to sitting. Then sitting leads to standing. It makes sound sense to approach stroke rehabilitation in this way, copying infant development patterns and remembering also that limb loading or corrective weight bearing through the limbs is essential to progress. It ought to be noted that during his development, the infant takes increasing amounts of weight through his limbs, particularly his arms. Special attention must be given to the shoulder and hip patterns at all times, and this must apply to the weight-bearing positions. The shoulder must not be allowed to move into inward rotation, and the hip must not be allowed to move into outward rotation.